Welcome to our exploration of global health inequities. Around the world, people experience vastly different health outcomes, often determined by where they live, their income, and their access to resources. These differences are not just random, they are shaped by social, economic, and political factors. In this video, we'll uncover the reasons behind these disparities and why understanding them is crucial for building a healthier, more equitable world. Let's begin by defining what health inequities are and why they matter to everyone, regardless of where you live. Health inequities refer to unfair and avoidable differences in health status seen within and between countries. These are not simply differences, but are rooted in injustice. For example, a child born in a low-income country may have a much higher risk of disease or early death compared to one born in a wealthier nation. These gaps are influenced by factors like poverty, education, and access to healthcare. Understanding this definition helps us see that health inequities are preventable and not inevitable. When we look at the world map, stark contrasts in health outcomes become apparent. Some regions enjoy high life expectancy and low infant mortality, while others struggle with preventable diseases and limited access to care. These patterns are not accidental. They reflect deeper social and economic divides. By examining the global landscape, we can better understand where the biggest gaps exist and who is most affected by them. Health is shaped by more than just biology or genetics. Social determinants, like income, education, employment, and living conditions, play a huge role. For instance, people with higher education often have better health because they can access information and resources more easily. Similarly, safe housing and clean water are basic needs that many still lack. These social factors create the foundation for health inequities across the globe. Economic status is one of the strongest predictors of health. People living in poverty often face malnutrition, unsafe environments, and limited healthcare access. These barriers can lead to chronic illness and shorter lifespans. On the other hand, wealthier individuals and countries can invest in better healthcare systems and preventive measures. This economic divide is a major driver of health inequities worldwide. Access to quality healthcare is not universal. In many low-income countries, healthcare facilities are scarce, and medical professionals are in short supply. Even in wealthier nations, marginalized groups may struggle to receive adequate care due to cost, discrimination, or geographic barriers. Ensuring everyone has access to healthcare is essential for reducing health inequities. Education is closely linked to health outcomes. People with more education tend to live longer, healthier lives. They are more likely to understand health information, make informed choices, and access services. Conversely, lack of education can limit opportunities and increase vulnerability to illness. Improving education is a powerful tool for addressing health inequities. Gender plays a significant role in health inequities. In many societies, women and girls face barriers to education, healthcare, and economic opportunities. This can lead to higher rates of illness and mortality. Addressing gender disparities is essential for achieving health equity, as everyone deserves the chance to live a healthy life, regardless of gender. Racial and ethnic minorities often experience worse health outcomes due to discrimination, poverty, and limited access to care. These inequities are seen in both developed and developing countries. Tackling racism and promoting inclusion are vital steps toward closing the health gap for all communities. Where you live can determine your health. Rural areas often lack hospitals and doctors, while urban slums may have overcrowded and unsanitary conditions. Geographic disparities mean that some people are more exposed to health risks simply because of their location. Bridging these gaps requires targeted policies and investment in underserved regions. Government policies have a huge impact on health equity. Policies that expand healthcare coverage, improve education, and reduce poverty can help close health gaps. Conversely, policies that neglect vulnerable populations can widen disparities. Effective policymaking is essential for creating lasting change in global health. Health inequities have deep historical roots. Colonialism, slavery, and systemic discrimination have left lasting scars on many populations. These historical injustices continue to influence health outcomes today, making it important to address both current and past inequalities in our efforts to achieve health equity. Globalization has connected the world in new ways, but it has also created new health challenges. Diseases can spread rapidly across borders, and economic changes can disrupt local healthcare systems. At the same time, globalization offers opportunities for sharing knowledge and resources to address health inequities together. The environment plays a crucial role in health. Pollution, climate change, and unsafe water can cause serious health problems, especially in vulnerable communities. Addressing environmental issues is a key part of reducing health inequities and ensuring everyone can live in a safe, healthy environment. Access to nutritious food is essential for good health, yet millions of people around the world suffer from hunger or malnutrition. Food insecurity is often linked to poverty, conflict, and environmental challenges. Ensuring everyone has enough to eat is fundamental to closing health gaps. Children are especially vulnerable to health inequities. In many parts of the world, preventable diseases, malnutrition, and lack of clean water threaten children's lives. Investing in child health is not only a moral imperative but also essential for building healthier societies in the future. Maternal health is another area where inequities are stark. In some countries, women lack access to prenatal care, skilled birth attendants, and emergency services. This leads to higher rates of maternal and infant mortality. Improving maternal health services is key to reducing these disparities. Communicable diseases like HIV, tuberculosis, and malaria disproportionately affect low-income countries. Limited access to vaccines, medicines, and information makes it harder to control these diseases. Global cooperation and investment are needed to ensure everyone can benefit from advances in medicine. Non-communicable diseases like heart disease, diabetes, and cancer are rising worldwide, especially in developing countries. These illnesses are often linked to lifestyle factors and limited access to preventive care. Addressing them requires both education and better healthcare systems. Mental health is often overlooked in discussions of health inequities. Stigma, lack of services, and cultural barriers prevent many from seeking help. Mental health issues can be just as debilitating as physical illnesses, making it vital to include mental health in global health strategies. People with disabilities often face additional health challenges and barriers to care. Inaccessible facilities, discrimination, and lack of support can worsen health outcomes. Promoting inclusion and accessibility is essential for achieving health equity for all. War and conflict disrupt healthcare systems, displace populations, and increase the risk of disease. Refugees and those living in conflict zones often have limited access to basic services. Addressing health needs in these settings is a major challenge for the global community. Migrants and refugees often face unique health challenges. Language barriers, legal status, and lack of resources can prevent them from accessing care. Ensuring that migrants receive adequate health services is crucial for both their well-being and public health. As populations age, new health challenges emerge. Older adults may face chronic illnesses, disability, and social isolation. Societies must adapt healthcare systems to meet the needs of aging populations and ensure that older people are not left behind. Rapid urbanization has created both opportunities and challenges for health. While cities can offer better services, they can also lead to overcrowding, pollution, and new health risks. Managing urban growth is key to ensuring that everyone benefits from city life. Rural communities often face unique health challenges, including fewer healthcare providers, longer travel distances, and limited infrastructure. Addressing rural health needs requires innovative solutions and investment in local services. Technology has the potential to bridge health gaps by improving access to information and services. Telemedicine, mobile health apps, and digital records can make care more accessible, especially in remote areas. However, the digital divide means not everyone benefits equally. International aid plays a vital role in supporting health systems in low-income countries. Aid can fund vaccines, build clinics, and train healthcare workers. However, it's important that aid is sustainable and supports local leadership for long-term impact. Communities are at the heart of health equity. Local leaders, organizations, and residents can identify needs and develop solutions that work in their context. Engaging communities ensures that interventions are relevant and sustainable. Data is essential for understanding and addressing health inequities. By collecting and analyzing health information, we can identify gaps, track progress, and make informed decisions. Reliable data helps ensure that resources are directed where they are needed most. Strong health systems are the backbone of health equity. This means having enough trained staff, reliable supply chains, and effective management. Strengthening health systems ensures that everyone can access quality care no matter where they live. Universal health coverage means that everyone can access the health services they need without financial hardship. Achieving this goal is a major step toward health equity as it removes cost barriers and ensures care for all. Preventing disease and promoting healthy behaviors are key strategies for reducing health inequities. Vaccination campaigns, health education, and community outreach can help people stay healthy and avoid costly illnesses. Research helps us understand the causes of health inequities and develop effective solutions. By studying what works and what doesn't, we can design better programs and policies to close health gaps. No single organization can solve health inequities alone. Partnerships between governments, NGOs, businesses, and communities are essential for creating lasting change. Working together, we can pool resources and expertise to tackle complex health challenges. Raising awareness about health inequities is the first step toward change. Advocacy efforts can influence policy, mobilize resources, and inspire action. Everyone has a role to play in promoting health equity, from individuals to global organizations. Tracking progress is essential for holding ourselves accountable. By setting clear goals and measuring outcomes, we can see what's working and where more effort is needed. Regular evaluation helps ensure that health equity remains a priority. The global response to HIV/AIDS shows both the challenges and successes in addressing health inequities. While some countries have made great progress, others still struggle with stigma, lack of treatment, and high infection rates. Learning from these experiences can guide future efforts. The COVID-19 pandemic exposed and widened existing health inequities. Access to vaccines, healthcare, and information varied widely between and within countries. The pandemic highlighted the urgent need for global solidarity and investment in health systems. Malaria remains a major health challenge in many low-income countries. Despite being preventable and treatable, millions are still at risk due to poverty and weak health systems. Success stories show that targeted interventions can make a difference. Efforts to improve maternal health have saved countless lives, but challenges remain. In some regions, maternal mortality rates are still unacceptably high. Learning from successful programs can help replicate progress in other areas. Vaccination campaigns have dramatically reduced diseases like polio and measles. However, gaps in coverage remain, especially in remote or conflict-affected areas. Ensuring universal access to vaccines is a key step toward health equity. Looking ahead, new challenges like climate change, emerging diseases, and shifting demographics will shape global health. Addressing these issues requires innovation, collaboration, and a continued focus on equity. Health inequities are not inevitable. By working together, investing in solutions, and holding leaders accountable, we can build a healthier, fairer world. Everyone has a role to play in closing the health gap and ensuring that no one is left behind. In summary, understanding global health inequities is the first step toward change. By addressing the root causes, social, economic, and political, we can create a world where everyone has the opportunity for good health. Let's continue to learn, act, and advocate for health equity everywhere.